So I'll be asking you questions today. And I often ask the same questions more than once. So pay attention, because you'll probably get asked a question I just asked the person before you, just to kind of just do that. But let's do some stuff. Let's do some real basic muscle review first. Let's talk about muscle groups like the calves and the hamstrings and the quads and the adductors and the glutes and the deep six and the spinal erectors and the 5 muscles that attach the scapula onto the axial skeletal system and the rotator cuff muscles, and that's all the ones I can think of. That's pretty good though, huh? Okay, good. All right. Miss Jung. Miss Jung? By the way, I'm sorry, I'm sure I never say your name really properly, but we'll get better. But Miss Jung, I'm not making fun of you. I really want to just make sure you remember this. What is this muscle? Minor. That was really good. Pectoralis.
Pectoralis.
Minor.
Minor.
I like that.
Thank you.
No, don't go anywhere yet. What's this muscle?
Pectoralis major.
Yes,
Major.
pectoralis major. Okay.
Major.
Can I ask you some more questions really quick? Just a couple more. What muscle is right here? It's okay if you don't know. We'll say it together. Do you want me to say it with you? Yeah. So, deltoid. Deltoid. Yeah. So, pectoralis minor. Let's break it up. Yeah. No, you're good. Let's break it up. Pectoralis. Pectoralis, yeah. Minor. All right. So, pectoralis. Minor. Pectoralis major. Deltoid. Good. We're done. Good. That takes a tremendous amount of bravery. Thank you. Thank you. I'll be back for you though.
Thank you.
Good. Miss Walker, why? Miss Walker, why? Hi. Hello. Very serious look you have there. Are you nervous? Let's do some muscle review. Can you tell me the 3 calf muscles that are found in the sural region of the leg?
Sural, that's...
Posterior leg.
Okay. Transverse Abdominis, Soleus, and Plantaris.
Very cool. Thank you, ma'am. Miss Walker T. Miss Walker?
Yes.
Miss Walker T, can you tell me the 3 calf muscles that are found in the posterior leg, and then can you tell me the 3 hamstrings that are found in the posterior thigh?
Okay, so we want the 3 okay, wait, can you ask the question more time?
Sure, I'm sorry, it was a little fast. Can I get the 3 calf muscles? Those are just the 3 muscles that we consider to be your calf muscles. They're found in the sural region, fairly superficial in your leg, which is your posterior leg. And then I also want the 3 hamstrings as we head up your thigh. There's 3 hamstrings and back too.
Can you explain it just a little better?
Can I explain it better? Oh.
No.
I mean, I can. Do you want me to? I couldn't tell if you were joking or if you want me to, I would be happy to.
No, I just thought if I asked that, I could maybe biceps femoris, the semitendinosus, and the semimembranosus.
Yes. Sorry, I was getting ready to draw a diagram in case I had to. Okay. 3 calves, 3 hamstrings. Thank you very much. It's been a pleasure. Miss Vincent. Hello. Can you tell me the 3 calf muscles, the 3 hamstring muscles, and the 3 gluteal muscles?
The 3 calf muscles are the gastrocnemius, plantaris, and
Soleus.
soleus. And the 3 hamstring muscles are biceps femoral, semimembranosus, and
Tendinosus.
tendinosus. And the 3 glute muscles are the Gluteus Maximus, Gluteus Minimus, and Gluteus Medius.
Yeah, I like it. Okay, good job. Thank you, ma'am.
Welcome.
Miss Routson.
Yes.
Hi, Miss Routson. Miss Routson, this is going to come as a shock to you, but can you tell me the 3 calves, the 3 hamstrings, the 3 glutes, and the 3 erector spinae muscle or spinal erector muscles? You may not be able to.
You do this to me.
'Cause I-
Okay, that's a lot of threes that you're asking.
That's well, yes, and so as the good teacher in me is trying to show you guys some patterns, right? So that you can be like, oh, 3, 3, 3, 3, 3, yeah. But anyway, so don't blow it, Miss Routson. Everybody's listening, and do not mess up this lesson of mine.
I'm gonna need you to lower your expectations, Mr. Pascal. Okay, the back of the calf is the gastrocnemius, the soleus, and the plantaris. The back of the leg.
Back of the thigh, yep. Posterior thigh, posterior femoral compartment, yeah.
That one I don't know.
Okay, that's okay. Don't worry. Hold that thought for 1 second because Miss Vincent does know. So, Miss Vincent, what were the 3 hamstrings?
Biceps femoris, semimembranosus, and semitendinosus.
Thank you. Okay, there we go, Miss Routson. Those are the 3 hamstrings. So what are the 3 hamstrings?
The semimembranosus, the semitendinosus, and the biceps femoris.
You're 100% correct. I have a really quick question. What does biceps femoris mean?
It is located, the femoris tells me it's located near the femur, and biceps means a bi-headed muscle.
Yes, thank you. Bi, 2, seps, head, femoral. 2-headed muscle found on the femur. I love what you just said there. Thank you. You have redeemed yourself. All right, so that's the 3 calves, gastrocnemius, soleus, plantaris. 3 hamstrings, semimembranosus, semitendinosus, biceps femoris. What are the 3 gluteals? Miss Routson.
Gluteus Maximus, Gluteus Minimus, and Gluteus Medialis?
Gluteus medius. Close enough.
Medius.
And what are the 3 erector muscles?
Erector Spinae.
Well, they are it's the Erector Spinae group. Yes. Sorry, I had to think that.
I was hoping you weren't going to call on me before I got my book. And
That's okay.
I don't know those.
That's all right. Hold that thought right there. Miss Vincent, do you know the 3 spinal erector muscles? She's like, jeez. Hey, it's not my fault, Miss Vincent. It's Miss Routson. I got to keep calling you. I can't help it. I mean, we got to, help her out.
I did it one time, I don't today.
Okay, that's totally cool. Totally cool. Miss Trotter. Poor Miss Trotter. Miss Trotter, what are the 3 erector spinae group muscles? They're these muscles. We're about to learn about them, actually. We're way ahead of ourselves, but there's 3 muscles that run up and down your back. And I think you know them. I'm getting the feel that you know this. Yeah.
I might not pronounce them correctly, but it's the spinalis.
Spinalis.
The longissimus.
The longissimus.
And the iliac
Iliocostalis.
iliocostalis.
Yeah. So spinalis, longissimus, iliocostalis. There's actually 3 on each side. So spinalis, longissimus, iliocostalis. Spinalis, longissimus, iliocostalis. Thank you so much. Ms. Rotson, did you get that?
I did, thank you.
Ms. Rotson, what are the 3 erector spinae muscles?
That would be the spinalis, the longissimus, and the iliocostalis.
Thank you, ma'am. It's been a pleasure talking to you. Ms. Vincent, what are the 3 spinal erector muscles?
Longissimus, iliocostalis, and the other one has spine in it. Spinalis?
Yeah, spinalis. You got it. You got it. Thank you. Good job. Thank you for your patience with me. Mr. Tate, sir. Here, Mr. Tate. What are the 3 calf muscles?
The gastrocnemius, plantaris, and the No, I know this. I'm sorry. The plantaris, the gastrocnemius, and the oh gosh.
I'm laughing. I'm not laughing at you, sir. I'm laughing at your lack of filter because you'll be like, oh. Anyway, so
soleus.
Yeah, soleus, plantaris, and gastrocnemius. You did great. What are the 3 hamstrings now, sir?
The biceps femoris, the semi-tendinosus, and the semi-membranosus.
Yes. What are the 3 gluteals, sir?
The gluteus maximus, the gluteus minimus, and gluteus minimus, maximus, and then mid, max, and then is it? Hold on.
It's okay. You gave me a big one.
Medius.
Yes. Big. Yeah. So big, middle, and little. Gluteus maximus, medius, and minimus. Beautiful. And what are the 3 erector spinae muscles?
The spinalis, the longissimus, the iliocostalis. Sorry.
No, don't be sorry. That was fantastic. Thank you, sir. Well done. Well done. Miss Suriel.
Yes, Mr. Kafka.
Miss Suriel, this is a hard question. I don't know if you know the answer, but, well, first, can you tell me the 3 gluteal muscles?
Gluteal maximus, gluteal minimus, and gluteal medius.
Yes, that is 100% perfect. I would prefer, and this is for everybody, Miss Suriel, I'm just making an example here. I would prefer we all say maximus, medius, and minimus because that's the way they fall on our body. So my buns and back are maximus, then when I go to my hips on the side, that's medius, and when I go just a little bit in front, that's minimus. So max, med, min. All right, so from posterior to anterior, what are the 3 gluteal muscles, Miss Suriel?
Gluteus maximus, gluteus medius, and gluteus minimum.
You make me proud, ma'am. Okay, now, ma'am, if we peel the gluteus maximus, the largest, arguably, muscle in the entire body, probably, but if we peel that off somebody, underneath it, in this small little area, about the size of this, actually, we will find 6 deep lateral hip rotators. Is there any chance, and it's okay if you don't, we haven't even gotten close this far, but is there any chance you know the names of the 6 lateral hip rotators, which are probably the most difficult names in the entire course, by the way?
Gemellus inferior, gemellus superior, obturator externus, obturator internus, quadratus femoris, and piriformis.
Oh, God. God, it's like you're singing a song. The pronunciation is unbelievable. No, I'm not kidding you. Spanish speaker, Latin is a Romance language, and so is Spanish. So that's exactly right. It's piriformis. That's great. Okay, so that was perfect. So a little added information, everybody. Underneath the gluteus maximus is these 6 muscles. They, on somebody's hip, just trying to get brightly colored pens or something. The piriformis is the most superior, and the Quadratus Femoris is the most inferior, and all the other 4 are in between them. So if I do this, it really is about the size of your lateral hip rotators. This is the piriformis, and this is Quadratus Femoris, and this is gemellus superior and gemellus inferior, obturator internus, and obturator externus. They all live right there. And I'm telling you that because these are the 2 easiest to find later when we learn to find them. Is piriformis and Quadratus Femoris. So, it's great when you say them if you're aware of that, because I will ask you, like, what's the most superior one? This is the most superior one, this is the most inferior one, and they're both the easiest to find, to palpate. So piriformis and Quadratus Femoris, in a way, are the ones we care about the most from the point of being able to find them, landmarks, things like that. Piriformis can pinch on the sciatic nerve. Quadratus Femoris means a 4-sided muscle found on the femur, by the way, and it looks kind of like a rectangle. So it looks more like that. Because apparently I can't hold my fingers like that. But anyway. Cool. Thank you very much, ma'am. That was really fantastic. I'm serious. Really well done. Okay. Okay. Miss Allure. Miss Allure.
Yes.
Hi, Miss Allure.
Hi.
Have you been paying attention to all this?
Yes.
Okay, good. All right, but what I'm worried about is, Miss Allure, I'm not worried about you. We all know you're paying attention, but I'm worried about the rest of these students. So can you help us review everything we've done so far? So, Miss Allure, what are the 3 calf muscles?
Gastrocnemius, plantaris, and solaris.
And soleus, yes.
Soleus.
Yes, but that's a great mistake you made. That's fine. Do you know, by the way, which... Well, let's wait. Sorry, I'm getting way ahead of myself. What are the 3 hamstrings?
Biceps femoris, semi-tendinosus, and semi-membranosus.
Beautiful. What are the 3 gluteals?
Gluteus maximus, gluteus medius, gluteus minimus.
Yes. Underneath the gluteus maximus, there's a deep 6. There's deep 6 deep lateral hip rotators. What are their awful names?
Femoris.
What?
Arbitrary. Is it femoris? What do you say?
Quadratus femoris.
Okay, Quadratus Femoris. Obturator.
Yeah, obturator.
Internus and obturator externus.
Yeah.
Gemellus superior and gemellus inferior and performance. How do you say that? Is it performance with a P?
Piriformis.
Piriformis.
Yeah. Good job. Okay, last question. What are the 3 erector spinae muscles up here?
Spinalis, longissimus, and iliocristalis.
Awesome. Thank you. Thank you. It's been a pleasure, ma'am. Good review. Good job. Okay, is somebody ready? Oh, sorry. Miss Walker T, yes. Talk to me.
Yeah, Mr. Tapscott, this was a kind of a question to go with when you were talking about the internal rotators, and you were saying when we get to where we're really finding them and how to fill them. I was just wondering when do we start like finding the muscles, or do we really? I mean, we've been massaging our partners, but do we ever like spin classes just like palpating, trying to find certain muscles?
Do you mean, do we have the course set up that way? No. That's the really quick answer. You can sure do your labs that way, though.
Okay, that
Right.
was kind of my question, is if I'm trying to find muscles, it's okay to spend time just trying to figure out where they are. I didn't know, like, later we were gonna go, you know, like, specifically do that in lab.
Yeah. By the way, we've tried it before. It doesn't work as well as you think. The activity works well if everybody participates, but the problem is getting everybody to participate. But you can actually give a very good massage just outlining muscles.
Okay.
So if I take just my deltoid and I find where it inserts down here at the deltoid tuberosity on my humerus, then just tracing it actually makes me massage it, right? Because I have to trace it, and if I truly, truly trace it to the origin, a lot of what we're doing right now is like deltoid. Okay, but if I truly trace it to the origin, I will actually get it all the way to the lateral 1/3 of the clavicle. I will actually be able to trace it over to the acromion process and the entire spine of the scapula. And when you start really tracing muscles down and grab them and talk to your partner about them, you will learn your anatomy so well. And you'll also become very, very good at massage, because really massage is what? It's being very articulate with what we're touching. So I highly recommend it. It sounds like a cop-out that we don't teach it, but there's nothing stopping you from doing it, literally.
Okay.
Yeah, and that's what you actually have to. And there will be times, because I know there will be times like this, because I still have times like this, where you're like, I'm not sure if that's such and such. And that's when you start moving stuff and going, well, if this is the pectoralis major, it should be attached to this arm. And this arm, it medially rotates, so I'm going to laterally rotate the arm and see if I can feel the muscle moving. I did feel the muscle moving. It's probably the pectoralis major. You start doing stuff like that in your head. And you are very ready to do that, ma'am.
Okay, I was just making sure, because I thought, well, if we go over this some later date specifically, then I guess I don't need to worry about it so much right now. But we can use our massage time being very exploratory like that.
I would prefer it. I would prefer that you are getting ridiculously detailed about individual muscles and truly, truly finding where they start and begin. Because I don't, because that's when you actually really learn the anatomy. So yes, please take it away. Don't let us hold you back. Cool. Miss Sarno. Hi, Miss Sarno. Hi. Okay. Let's see. Do you know the 3 calf muscles, Miss Sarno? Down in the leg. Gastrocnemius. Soleus. Plantaris. Gastrocnemius. Soleus. Plantaris. Wow! That was very good. Do you know the 3 hamstring muscles?
Biceps femoris.
Biceps femoris.
Semimembranosus.
Semitendinosus. Semitendinosus. You're doing really good. Do you know the 3 gluteal muscles? Yeah.
Gluteal muscle,
Gluteus Maximus.
Gluteus Maximus. Gluteal, Gluteal medius.
Gluteus Maximus, Gluteus medius, and Gluteus minimus. That was good, though. Do you know the 3 spinal erector muscles?
Spinalis. Longismus, and I don't know how to.
Nope, nobody knows how to say it. So it's ilial.
Ilio.
Yeah. Costalis.
Costalis.
Beautiful.
Ilio costalis.
Fantastic. Thank you, Ms. Sarno. Very, very impressed with you. Thank you. Thank you, thank you, thank you. Mr. Riedel. Good sir.
Yes.
Mr. Riedel, do you know the 4 quad muscles that exist on the anterior and lateral compartment of the femur? This is a curveball, so it's okay if you don't. I really mean that. 3 have the word vastus in them.
Oh, vastus medialis, vastus intermedialis, vastus minimus. No.
That's cute. Lateralis. You got a medialis, you got a lateralis, and an intermedius. And then?
Rectus femoris.
Very good. Can you say all 4 of those again, sir, just so everybody can hear? Because I'm going to ask other people the same question.
So there's the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius.
Yeah. Well done, sir. Do you know which one is most superficial?
Probably. Is it lateralis?
Rectus femoris probably is most superficial.
Okay.
Although vastus lateralis is superficial on the side. You're right. It was not a bad guess. All right. Cool. Thank you, sir. Thank you. Okay. I like it. Mr. Placencia. Did you get that? Okay. Oh, that's right. We have to log in. Yeah. That's all right. Take your time logging in because I got lots of questions for you, sir. Lots and lots.
All right, I'm ready.
Okay. All right, sir. So what are the 4 quad muscles, sir?
The 4 quad muscles are the vastus medialis, vastus lateralis, and vastus intermedius, and rectus femoris.
Yeah. Very good. What are the 3 hamstring muscles?
The 3 hamstrings are the semitendinosus, semimembranosus, and biceps femoris.
Yep. And then on your inner thigh, on your medial femoral compartment, the place that rubs together when we walk down the hallway, the place where your corduroys get rubbed. You guys don't even know what corduroys are. Anyway, you have 5 hip adductor muscles because they pull your legs together. They're adductor muscles. 5 hip adductor muscles. Do you know what their names are?
There's adductor magnus, adductor longus, and adductor brevis. And there's the pectineus and the gracilis.
Woo! I think I know what happened to your last mic. I think it melted. Because you were on fire. Okay. That's good, sir. I feel like you've kind of taken us through the femoral thing there, you know? Yeah. All the how many muscles is that? 8? 12 muscles of the femur there? That's really good. Yeah. Awesome. Thank you, sir.
Yeah.
Miss Munoz. Where did you go?
I'm right here.
All right, good, Miss Munoz.
I was hiding.
Yeah, I was actually, I thought you might be like, forget it, I'm out of here. Miss Munoz, what are your 3 hamstring muscles?
Hamstring muscle.
Back of the leg, yeah. Posterior femoral compartment. 3 hamstring muscles.
Is that the biceps femoris? Semitendinosus and semimembranosus?
That is exactly correct, Miss Munoz. Miss Munoz, you've done so good at that you've now graduated to be able to tell me the 4 quadricep muscles on the anterior and lateral compartment of the femur.
The anterior is that the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius.
Yes, which gets you to the pyramid level of questions, which are one of the 5 hip adductors found in the medial femoral compartment.
Adductor magnus, adductor longus, adductor brevis, gracilis, and the pectineus.
Thank you, Miss Munoz. Couldn't have done it better myself. That was awesome. Thank you.
You're welcome.
Mr. Brown, you have your hand raised.
I have a question.
Please, sir. I have an answer.
So the quad muscles and the hamstring muscles are the anterior and posterior leg, but are there any more, or are those 8 all of them?
Well, do you mean have we listed off all the muscles that are found in the femoral compartments in the thigh?
Yes.
Okay.
Or is there like in some that we just haven't went over yet?
There's one that we haven't gone over yet. So you've got 3 hamstrings, 4 quads, 5 hip adductors, and 1 sartorius.
One what? Say that one more time, please.
One muscle called, if it's all by itself, called the sartorius.
The Sartorius?
Yep, I will,
And
yeah, go ahead.
So
I'll go for broke because. Oh, go ahead.
No, you go. I'm butting in.
So
Oh no, I was about to name the quads and the hamstring muscles.
Oh, you must.
But you go first.
Well, you must know me well because I was about to ask you that, sir. But really quickly, the sartorius is a diagonal muscle that starts all the way up at your anterior superior iliac spine, your hip, and crosses diagonal over your leg and goes in down below your knee. And it is the most superficial thigh muscle you've got in front, and it's called the sartorius. And it's actually the reason that we can sit cross-legged. Otherwise, you'd have a really hard time. So you have 3 hamstrings, 4 quads, 5 hip adductors, and a sartorius, which I think gives us, what, 13 femoral muscles, basically. Yeah, that about covers them. So, sir, what are the 3 hamstrings?
The hamstrings are the front.
Oh, no. Hamstrings are not. Whoa.
No, hamstrings in the back.
Thank you. Posterior femoral compartment hamstrings.
Posterior is the thing. I was so confident. I just had them, and now I'm blanking.
Yeah.
So we have the semitendinosus, the semimembranosus, and the it was femoris. Biceps femoris. And then on the front we have the vastus medialis, the vastus. No, you don't want it in that.
No, that's all right. Take it.
The vastus lateralis, the vastus intermedius, the vastus medialis, and then the rectus femoris.
Yes. And what are the 5 hip adductors?
Those ones, I don't have my notes with me. I'm still driving, so I don't know those ones.
That's
those
okay.
ones I have a hard time.
Yeah.
So can you walk me through?
3 of them have the name adductor in them.
There was what I remember Miss Cynthia saying one. Adductor, was it like adductor large, small, and medium?
It's actually adductor giant, long, and short. So it's adductor magnus. Adductor magnus.
Magnus and
longus. Just say
was
longus.
that also one of the what the name?
Right. But sir,
adductor magnus, adductor longus, adductor
brevis.
Brevis?
So adductor longus, adductor brevis, adductor magnus, and then gracilis and pectineus.
Gracilis abdominis?
Pectineus.
No, pectineus, like pecs.
Yeah, but not down there, but up there, yeah, but yes, like pecs. Yeah. Thank you, sir.
Oh, okay, good. I'm gonna study the adductors more because they keep giving me a hard time.
Oh, you're saying that because your mother's there. Yeah, you better study them more. Because I'll call her. Thanks, sir. Miss Estes, yes, you have a question or a comment or an insight? Or maybe all 3?
I do.
Please.
Well, okay, so the QL, that's not a muscle, that's a tendon or something?
No. The Quadratus Lumborum, the QL?
Yeah, that goes down the leg, the outer side? The outer...
Oh no, I'm sorry, that's the IT.
The IT band. Oh, you ask a very good question. So, you're right. I haven't actually gotten to that muscle because there is a tiny muscle that controls the IT band called your tensor fascia lata. Or latte. And you're right. That's a muscle on the outside of the leg here that controls some of the tension on your IT band is this tiny muscle right here. And actually, if you go from posterior on your buns to anterior, it goes gluteus maximus, gluteus medius, gluteus minimus, tensor fascia lata. Yeah. And that's a very helpful thing I just did there, because later we want to know what's going on at your hips. And if things in back tend to pull in back, things on the side tend to pull in the side, things in the front tend to pull in front. So knowing that gluteus maximus, medius, minimus, tensor fasciae lata can be very helpful. And you were absolutely right. That would be a 14th muscle that I left out. Yes.
Okay.
So yes, kudos to you. Thank you.
But the band, the IT band, that's not a muscle.
No, what would, there's not a wrong answer to this exactly, but what is one of the things that the IT band could be considered? Now that you know that this is the tensor fasciae lata right here. What's
a tendon?
Yes! 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 Thank you. Thank you. Well, I'm very excited, by the way, because it shows an understanding of what a tendon is, right? So the only reason they don't call it a tendon is it's not like a rope. It's more flat, right? Like a long belt or a band or an IT. That's why they call it the iliotibial band, the iliotibial tract. But it's a tendon for the tensor fasciae lata and the gluteus maximus that attach over here, actually. And so that's a very legitimate way of looking at it. And it's a tendon that runs all the way down the thigh and across the knee. So we don't call it a tendon because it's not rope-like, but it is made of tendon material. It operates the same, and very much so you could call it that. Brilliant.
Okay.
Yeah.
Cool.
Very cool. Very cool. Thank you, ma'am. It's a good day. Yeah, really is. Okay. Miss McDowell. We meet again.
Hi.
Yeah. Instead of you having questions for me, I have questions for you.
No.
Yes. All right, Miss McDowell, I want to preempt this to say that I'm going to ask you the stuff I've already been asking, but I'm going to ask you some additional questions, and you honestly may not know them. I don't know that I've really covered them, but everybody's doing so well that I want to add another layer of detail to what we're doing. So first, can you tell me the 3 calf muscles?
The calf muscles are the gastrocnemius, the soleus, and the plantaris.
Good. Now, can you tell me the 3 calf muscles from superficial to deep?
Gastrocnemius is the most superficial, then soleus, then plantaris.
Yeah, and that's a little bit of a trick question because the plantaris is kind of above the soleus, so I guess they're both the same level. But I wanted exactly what you gave me. So Miss McDowell here not only told us the 3 calf muscles, and she did this the first time too. She has them memorized in order from superficial to deep, which is very smart. We should all be like Miss McDowell right now and learn the muscles from superficial to deep. Because when I touch them, then that's the way I touch them, right? So when I'm touching the back of somebody's leg, say a stranger on the street, while I'm getting arrested, I am touching their gastrocnemius, and if I push in further, I would be putting pressure on their soleus, and if I move up and further, I'd be on their plantaris. So anyway, that's a great way to remember them. Gastrocnemius, soleus, plantaris. Yeah, okay? Especially gastrocnemius is on top of soleus. That's the really important part to remember. Plantaris is an adorable muscle, by the way, but it's kind of off on its own, doing its own thing. They all 3 share, though, the same tendon. All 3 of your calf muscles insert into your heel via the calcaneus tendon or the Achilles tendon. Anyway, all right, so what were those 3 muscles again from superficial to deep really fast?
Gastrocnemius, soleus, plantaris.
Thank you. Gastrocnemius, soleus, plantaris. What a great way to remember. I would even guess that Mr. Tapson's going to ask this question for the next 8 months. So this is good. Okay, so you got that one. What are my 3 hamstring muscles?
Hamstrings are biceps femoris, semitendinosus, and semimembranosus.
And can you list those from lateral to medial?
Lateral is the bicep femoris, then the semitendinosus, then the semimembranosus. I know the bicep femoris is on like the one side, and then the other 2 are on the other side because he's big and he doesn't want to share.
Yeah, and I'm laughing because you listed them this way already. But yeah, biceps femoris is on the lateral side. It's the 2-headed muscle on the lateral side. The semimembranosus and semitendinosus are on the medial side. And I don't care which way people list them, but I want you guys to know the difference between the medial side and the lateral side. So kind of between my thighs are the semimembranosus and semitendinosus. On the lateral parts, on the outside of my thighs, in back, or the biceps femoris. Really well done. Could you list them from lateral to medial one last time for us?
Yes, biceps femoris, semitendinosus, and semimembranosus.
Hey, I just realized the most medial one has an eminent, and medial has an eminent. Semimembranosus is the most medial. That's kind of cool. Okay, can you tell me the 3 gluteal muscles from posterior to anterior?
Yes, the Gluteus Maximus, Gluteus Medius, Gluteus Minimus, and then the tensor lata. Yeah, the TFL.
Tensor fascia latae, or I hear people say it a lot of different ways. I just remember it tenses up a lot of fascia. Tensor fascia latae. It's not a gluteal muscle, right?
But it's like it's not a gluteal muscle, but
it's not. But by the way, here's something very interesting, everybody. The gluteus maximus, which is a gluteal muscle, and the tensor fascia latae both insert into your IT band. So having Miss McDowell include this tiny little tensor fascia latae in this discussion is a very good idea, and she's kind of naming stuff around the hip. So gluteus maximus, medius, minimus, tensor fascia latae. If we go even further forward than that, we get to the Sartorius. So if you really went around your hips from and back, it would be what 5 muscles, Miss McDowell?
Then you have the Gluteus Maximus, Medius, Minimus, TFL, and then the Sartorius.
And then the Sartorius. Beautifully done. Thank you, thank you, thank you. Okay, I think that's good for now. Yeah.
That's all? Okay.
That's all for now. That's all for now. Miss Mares. Miss Mares, can you tell me the 3 calf muscles from superficial to deep?
Oh yeah, I'll try. It's the gastrocnemius, soleus, and the plantar.
Beautifully done. Can you tell me the 3 hamstring muscles from lateral to medial?
Yes, the biceps femoris, semimembranosus, and semitendinosus.
Okay. Technically, maybe semimembranosus might be the most medial, but it doesn't matter. There's some intertwining on that side. That was good. Can you tell me the 3 gluteal muscles from posterior to anterior?
Yeah, the gluteus maximus, medius, and minimus.
And if we kept going more anteriorly, we'd run into another muscle. Do you know what that's called?
She just said it.
Yes.
You just said it.
It's hard.
I'm not sure.
Tensor fascia lata.
What is it?
Tensor fascia lata. Yep. And then if we go even more anterior, it's Sartorius.
Yeah, I got that one.
Good. All right. Cool. Can you tell me the deep 6 lateral hip rotators found underneath the gluteus maximus?
The external hip rotator?
Yes, they are external hip rotators. Sorry, deep 6 external hip rotators. You are right.
Yeah, they're the twin sisters.
You've been talking to Ibarra.
Gracilis, inferior, superior, arbitrator, externus, internus, calcaneus, and oh wait. Is it the calcaneus?
Piriformis.
The piriformis and the quadratus femoris.
Yeah.
I'm sorry, I'm not looking at my notes.
No. Miss Mares, you're doing great. Miss Mares, which of those 6 lateral hip rotators is most superior? That means most high up, like when the person's standing, really.
Would it be no.
The what? It's also the one that can pinch the sciatic nerve.
Oh, the piriformis.
Piriformis is most superior, one of the most easy to palpate, meaning to find, and can pinch the sciatic nerve. Which one is most inferior, and also very easy to palpate?
The Quadratus Femoris.
Yeah, Quadratus Femoris, very good. So piriformis up here, Quadratus Femoris down here, and the other 4 are sandwiched in there. And you can rub these 4, but good luck telling them apart. If you guys figure that one out, let me know, because I can't. Cool, thank you very much, Ms. Pares. Good job.
Thank you, sir.
Mr. Brown, you're raising your hand again, sir?
Yeah, I got a couple questions.
Okay.
I forgot what's the difference between a ligament and a tendon. A tendon connects muscle to bone, and a ligament is bone to bone.
Yes. And
or is it the other way around?
No. That was it. Tendons attach muscle to bone, ligaments attach bone to bone. You said it right the first time. You are correct. And if I were to cut out just the white connective tissue from a tendon and a ligament and show it to you, you wouldn't be able to tell them apart. So they're partially named by what they do, really. So
and then my next question, this one is kind of like what came first, chicken or the egg type of question. When you're looking at these muscles, is there a distinctive border that you can tell the muscles apart, or is it just like they know because they named them? And I just was thinking like how, like when you're going vastus medialis to vastus intermedius to vastus lateralis, like how do you know the difference?
Well, yes and no. So there is a difference in the sense that the muscle fiber changes, and you can tell if you've got a good sense of feel that you're onto a new muscle, and there is different fascia wrapping around them. Remember, we got fascia wrapping around each of our muscles. But what's not distinctive, and it's kind of hard, is that the inside of people's bodies tend to get glued together, and sometimes they should be. By the way, it's not always a bad thing. And so it's not like an anatomy chart. You know, like it's not like this leg, by the way. They make this leg look it's gorgeous and it's perfect. And when I go grab your legs and my legs, regardless what shape you're in or whatever, it's not quite that easy to have these separate out, right? So somebody has actually, to see a leg muscle like this, they've scraped fascia out between the muscles. But anyway, sir, yes, you can tell the difference between the vastus lateralis, the vastus medialis, vastus intermedius, and rectus femoris. You can, yeah. And you do it by following origins and insertions and staying very close on that muscle. It's a very good exercise to do. I mean, you guys would be very well served if you did that for the next 8 months, and that's all you did. You would graduate incredibly good massage therapists. I mean, incredibly good. Because you've now been able to identify and find every muscle and rub the entire length of it. You'd be amazing. Amazing. So, anything else, sir?
No, that was all. Thanks, Mr. T.
Cool. Miss Lobitz.
Yes.
All right.
Let's rock and roll.
What? Let's rock and roll?
Let's rock and roll.
All right, Miss Lobitz, let's rock and roll. Miss Lobitz, okay, since you're feeling like rocking and rolling, can I switch things up a little bit and ask you, do you know what the 5 abdominal muscles are? They're kind of found around this tummy area. And that was out of the blue, I'm sorry.
QL, the Quadratus Lumborum, the Rectus Abdominis. I know these are out of order.
No, this is good. We're happy.
And that's the one that gives you like a 6-pack, right?
Me especially, yeah. Yeah.
The obliques. There's the external, internal. Okay, external oblique, internal oblique. And there's a transverse abdominis.
That's it. Yeah. You made it look easy. I feel like you were kind of pretending, like trying to remember, but you really knew them all. Yeah. That was fantastic. Yeah, so in front you've got a rectus abdominis. Rectus means up and down. Rectus abdominis. Transverse abdominis. This is a belt around our tummies, everybody. Its job is to actually act like those belts you wear in the gym or you see people wear in the store. It's really to compress your midsection and make your spine stronger. Then we've got internal and external obliques. Those are on the side. Boom. And the Quadratus Lumborum, which is in back. It actually acts like a back muscle, even though it's an abdominal muscle. That was really good. Cool. Thank you. I think that really actually kind of does it. Yeah. Can you just say those 5 muscles for us one more time so that everybody can hear, because I'm going to ask somebody else, you know, that kind of thing.
Yeah, so the external oblique, internal oblique, Quadratus Lumborum, Transverse Abdominal, and Rectus Abdominis.
Beautiful.
Abdominis.
Yeah, we'll take it. Rectus Abdominis, Rectus Abdominal, anything, we'll take it. Thank you. Really well done. Good job. Thank you. Miss Karodi. Hello. What? Miss Crody, are you making exclamations over there? What are you doing? I can't hear you, Miss Crody. Oh, yeah. Don't pretend like you can't unmute now. What? What's going on? Miss Crody? Is your computer frozen? Yeah, all right. I'll come back to you, Miss Crody. Don't worry, I will not forget about you. Yeah. All right, Miss Hawks. All right, Miss Hawks, I feel like we have done a pretty good job of mapping out the body here. Yeah, so let's review some stuff. What are the 5 calf muscles in the posterior leg compartment or the sterile region from superficial to deep?
The calf muscles?
Yeah, I hope I said 3. Did I say 5?
Yeah, you said 5. I was a little confused.
There actually are 6 muscles back there, but the calf muscles are the 3 that I want to talk about right now. Yeah.
Okay, so the gastrocnemius, the soleus, and the plantaris.
Thank you, and thank you for not letting me throw you off. That was my bad. What are the 3 hamstring muscles?
The biceps femoris, the semimembranosus, and the semitendinosus.
Which one's most medial?
The semimembranosus.
You're 100% right. Semimembranosus with an M, most medial with an M. Great job. Can you tell me the 4 quad muscles?
The 4 quad muscles, the vastus intermedius, the vastus lateralis, vastus medialis, and the rectus femoris.
Very good job. Not surprised though. Can you tell me the 5 medial femoral compartment muscles, your 5 hip adductors?
The hip adductors. So the adductor brevis, adductor longus, adductor magnus, the gracilis, and the pectineus.
Pectineus. You will not know this answer, but I want the whole class to know, so I'm going to ask you a question. Of all those adductors, and this is totally a trick question because it's not the one you would think, which one is the longest and probably the most important in some ways?
I'm guessing the longest.
That's what you should guess. But the adductor longus is just the longest of the 3 muscles named adductor. The actual longest adductor muscle is your gracilis. Gracilis, everybody. And it's important because it crosses over your knee. So it not only affects your hip, it affects your knee. It's the only adductor that crosses over 2 joints. And so we'll talk about it a lot. The adductor, the gracilis. Anyway, thank you, ma'am. That was great. Let's see, you did calves, you did hamstrings, you did quads, you did adductors. What are the 3 gluteals?
Gluteus medius, gluteus maximus, gluteus minimus.
What are the 3 gluteals from posterior to anterior?
Posterior to anterior? Would it be the minimus, the medius, and the maximus, the medius, and then the minimus?
Yes, thank you. Max, med, min, then tensor fascia lata, then sartorius. Those aren't gluteals, though. You did great. Cool. Thank you, ma'am. Let's leave it at that. That was good. Really good. Cool. Miss Estes. Hello.
Hello.
How are you feeling with all this? Any parts kind of weak?
I don't know until you test me.
Okay, gotcha. Is there anything I should not ask you? Like, just not today, don't do the abs. That kind of thing.
No, I that's probably my weakest point, actually.
Perfect. What are the 5 abs? What are the 5 abdominal muscles?
Okay, that QL, which is the Quadratus Lumborum.
Lumborum. And honestly, everybody, let me show you something here too, everybody. It is honestly almost exactly this size right here. I'm showing you that because this is how I learn my muscles, is I use my hands. So, Quadratus Lumborum.
Okay. The transverse abdominal. Okay. The external obliques and the internal obliques. Okay. And then Rectus Abdominis.
Beautiful. Will you do me a big favor and just say them all again? That was great.
Okay. Quadratus Lumborum. Transverse abdominal. External oblique. Internal oblique. And the rectus abdominis.
Thank you. Well done. Yeah. That was good. That was good. Yeah. Hey, just to switch things up, what are the 5 muscles that attach the scapula to the axial skeletal system?
Okay. That is the levator scapula.
Levator scapula. I like levator.
Okay.
No. Apparently it's levator.
Levator. Okay. And then the trapezius and the serratus anterior, the pectoralis minor, and the rhomboids.
Rhomboids. Yeah. Okay. Good.
I was like, wait a minute. I was going to say rhombus, but that's like a mathematical thing, I think.
And I'm not sure any of these muscles are going steady or something, but I think some of them are kind of dating. At least, they hang out together sometime, see them walking hand in hand. I think sometimes they do stuff separately, but I still feel like there's a little coupling going on. Can you tell me, like, what's the gossip column on who's seeing who in this 5 muscle group here?
Well, it's in the Inquirer that...
Inquiring minds want to know.
The pec minor might be... Or no, is it?
Yeah. The pec minor is very...
Pec minor and the pec minor. Yeah, I am blanking right now.
Well, the pec minor is, everybody's got their turn-ons, and the pec minor really likes a great set of teeth. And so, it does. The pec minor really likes a great set of teeth, and it likes to hang out. Both these muscles like to go and eat ribs together, too.
Serratus, the serratus.
Saw-like, teeth-like. Got it.
The teeth.
Yeah.
Saw. Okay. That makes sense. And they're both going around the front.
Yep, and they both hang onto the ribs.
Okay. And then of course the trapezius and the levator.
Yeah, the trapezius is really weird, by the way. It almost acts like it's got multiple personalities. It's almost like it's got a superior and inferior and a middle portion. And I feel like not all portions really like the thing that's going on with the levator scapula. What part of the trapezius is really into the levator scapula?
Just the upper fibers.
Oh, the upper fibers. I agree. Cool. All right. Are there any other couplings that we should know about? Anything else going on?
Well, sometimes I think that the trapezius sees the rhomboids.
I think so too.
Yeah. the upper rhomboids. The minor, or what are they called? Are they major and minor?
Major, minor. I feel like, I realize, by the way, everybody, I pushed this analogy way too far, and I will stop in just a second, but I feel like the rhomboids, major and minor, and the middle trapezius are in a little bit of a threesome there. Just saying. Yeah. We call it a muscle trois. Yeah. That's the best I can do. Okay, good. So what we gain from this is that pec minor and serratus anterior both grab on the ribs. They're both in front. They both actually depress and protract the scapula. They like to hang out together. They often work on projects together. We got that the levator scapula and upper traps go in the same place essentially, and they often like to elevate together. We got that the rhomboids, major and minor, and middle traps, they like to start fights together, actually. They like to retract the scaps, and they're these guys right here. Yeah, good. Well done. Thank you, ma'am. And thank you for playing along. I appreciate it. Mr. Blygen. Hi, Mr. Blygen. It's all smiles. How we doing, buddy?
Good.
Okay, Mr. Blygen, I've kind of worked through the whole class here. I'm ending with you because you know, it's like a tug of war. You always put your strongest player right at the end of the rope. So you need to bring this home for us. If we discover any weak spots with Mr. Blygen, we'll know they could be weak spots for the whole class, and we can just start back over again. So, Mr. Blygen, what are the 3 calf muscles from superficial to deep?
The gastrocnemius, the soleus, and the Transverse.
Excellent. What are the 3 hamstrings from lateral to medial?
From lateral to medial is the Biceps Femoris, the semimembranosus, and the semitendinosus.
Close enough. What are the 4 quad muscles?
Wait, you said close enough. Did I get that wrong?
Well, so technically on a certain part of the thigh down by the knee, the semimembranosus is most medial.
Okay.
But because of the way the muscles fall, there are places where the semitendinosus is a little bit over too. So all I care is you guys remember that both those are on the medial side. So that's why I was like, it's close enough. It wasn't me being snotty. It was just like we could argue about it all day long kind of thing. So anyway, cool. What are the 4 quads?
The 4 quads are the Biceps Femoris, the vastus lateralis, vastus medialis, vastus intermedius, and did I say that?
I don't know. I literally kind of blanked out for a second. Will you do all the quads again?
Biceps femoris.
I know why you're saying it. Yeah.
What am I saying? Wait a minute. We're talking about the quad, right? In the front?
Yeah. There is a femoris, but it's not the 2-headed muscle.
Quadratus femoris.
No, that's the 4-sided.
What am I missing?
This one runs up and down.
Rectus femoris.
Yeah.
The vastus lateralis, vastus medialis, and vastus intermedius.
Yeah! Cool. What are the 5 hip adductor muscles, sir? In the inner thigh.
So those are going to be the Adductor Magnus.
Wait, what was the word? Adductor, okay.
ADD.
Yeah, ADD.
Magnus, brevis, and longus. And then that will be the piriformis. Or am I getting the...
Oh, I know why you said piriformis. Pectineus.
And gracilis.
Gracilis. Yeah, they're all starting to blend right now, huh? Yeah. What are the 3 gluteals from posterior to anterior? And then if you wanted to show off, you could take another 2 muscles anterior and keep telling us about the other stuff we might find after the last gluteal muscle. That was really poorly said on my part. If you understand what I just said, try to answer it. If not, just ignore part of that.
The Gluteus Maximus, medius, and minimus. Then there's the tensor fascia latae and the sartorius.
Bam! Nicely done! Wow! What are the, if we pull off the Gluteus Maximus, what are the deep 6 lateral hip rotators down there called? What are their names?
Deep 6 piriformis. I'm looking at that thing. Wait a minute. There is the piriformis. Give me the one at the bottom.
Quadratus femoris. It means a 4-sided muscle on the femur.
Quadratus femoris. And then in the middle is the. Oh my gosh! I'm blanking out here. They all have the 3. Wait. The 3 have the same names. but they're different. I don't know. I'm out. I failed.
So you've got an obturator internus externus,
Internus, externus,
gemellus.
and gemellus, superior and inferior.
Good. All right. All right. We're gonna let that. That's good, sir. Let's stop. Let's stop. We're gonna jumble stuff in your head more. That was good.
Yeah, I'm not confused here, but
Yeah.
I know it. I just, yeah.
Well, I'm pretty happy with everybody right now, so we're doing just fine. This is not even on the schedule for today, so very happy about this. All right, everybody, let's take a little break and then we'll come back, all right? That was a perfect break spot. I really appreciate what went on here, which is you facing fears and talking in public and messing up and repeating stuff and trying to say stuff. So it's fantastic. I'll see you guys back in 15 minutes, which puts us at 4:53. 4:53. Be there or be square. Bye, everybody. Oh, I'm late. Sorry, everybody. Okay. All right, we're all back. Hold on 1 second.
My computer is working right now.
Oh, it is? Okay, good. Yeah, thank you, Miss Crody. All right, Miss Crody, good. So can I ask you some questions?
Yeah.
Okay.
Please.
What are the 3 calf muscles?
That's the medial and the soleus and the plantar and rib.
That was really good. Gastrocnemius, soleus, and plantaris. I like that. What are the 3 hamstring muscles?
It's the biceps femoris, semimen muscles, muscles.
That was really good. They're such hard words too. Biceps femoris, semimembranosus, and semitendinosus. Well done. Thank you. What are the 4 quadriceps femoris muscles that are kind of found in your anterior and lateral compartments of your femur?
The part is the Rectus Femoris. It's the Vastus Lateral. Vastus Medial.
It's hard.
Medial. Let me speak Japanese.
So rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. Yeah, those are hard. What are the 5 hip adductor muscles that are found in your medial femoral compartment?
It's medial where you can adductor Muscles.
Wait, adductor what?
Magnus.
Yes, adductor magnus.
Adductor longus.
Adductor longus.
Like this base. And adductor brevis.
Adductor brevis. Well done.
Yeah. Pactinius.
Pactinius. Very well done.
I say that first base.
Gracilis. Yeah, that one's hard. Gracilis. A lot of these have sounds that you're not used to making. Yeah, very good though. Really good. Okay. What are the 3 gluteal muscles?
Gluteal here is a medial. Gluteal minimus, Gluteal minimus, max, yeah.
Okay, can we, Miss Crody, can we say these together?
Yeah.
So, gluteus,
Gluteus,
maximus,
maximus,
medius,
medial,
and minimus.
minimus.
Yeah, good. So gluteus maximus, gluteus medius, gluteus minimus. That's a lot. It's a lot. But while I've got you on the phone, maybe we should ask a few more things. What are the three erector spinae muscles that run up and down your spine? Spinalis. Longissimus.
Iliocostalis.
Yeah, iliocostalis. Nicely done. Okay, we're almost done, but you're doing so good, and it's great practice. So what are the 5 abdominal muscles that are found kind of in your... Rectus Abdominis. Yep.
Yeah. Internal oblique.
Internal obliques.
Yeah, oblique. Yeah. Actually, external oblique.
External obliques.
In a quadratus lumborum.
Yeah, that was good. That was good. Quadratus Lumborum. And then?
Is transverse abdominis.
Transverse abdominis. Good. Stop right there. That was fantastic. Thank you. Thank you. Mr. Placencia.
Can you hear me now?
Mr. Placencia, quit yelling at me. I'm your teacher. Huh, don't take that tone. Yeah, I can hear you really good.
Volume too loud? How would it kind of gauge it right now?
Well, wow, I wonder if it's very sensitive to distance. Anyway, it seems pretty good right now. Let's talk again.
Okay. How about now?
Wow, that's really loud now.
Okay, well, hold on. Let me turn that down.
Oh, you got a lot of adjustment here. Okay.
How about now?
That's nice. What do we think,
Okay.
everybody? Is that good?
We'll leave it right there.
Is that good? Does anybody want it louder, quieter? We can all vote. No? It's perfect. Okay. Miss McDowell, did you have something to say?
Yeah, I had a quick question. So the Deep Six has the, those are the obturators, right?
And gemelluses. And
Yeah. Hold up. So then the abdominal area has the other one, the obliques. I keep getting those kind of confused. Is there any way that you might try to remember them, like a better way?
well, I don't know if this is a better way, but why don't I explain more about them, and I think that'll stick in your head. Right? Where some people are like a little memory trick might work, but I think for you an understanding trick will work. So you're getting obturator internus and externus mixed up with external and internal obliques, right?
Yeah.
Okay. So 2 things that are kind of cool. For one thing, everybody, obliques mean diagonal. The word obliques mean diagonal, and we will learn other muscles that have the word oblique in them. That's why I'm saying it. So they are internal and external muscles on your tummy that go diagonal. So oblique means diagonal. You've actually got some suboccipitals that are obliques too and stuff like that, but we use it for diagonal muscles. That doesn't mean every muscle that's diagonal has the word oblique in it, but oblique means diagonal, essentially. So that's good to know too. So, do you remember the word for hole as in H-O-L-E?
The foramen?
Yeah, foramen. So, you've actually got holes I don't mean this one. You've got holes in your hips here, and this is actually where your pubic and your ischium come together, and they make there's this hole here. This hole is called the Obturator Foramen. You got it on both sides. And the Obturator Internus actually hooks on inside your hip and comes over here. And the Obturator Externus actually hooks on outside your hip and comes over here. And that's where they got the name Obturator. They actually cover, there's a membrane here. They cover the Obturator Foramen on the inside and outside. And that's why they're called obturators, because they cover the Obturator Foramen. And so I know that doesn't help you memorize anything, but I just thought you knowing that there's a hole in your hips on both sides called the Obturator Foramen, they're pretty big, and you've got an internal and external obturator muscle that's part of the deep six might help. Yeah. Did that help? I don't know.
Yeah,
we'll test you tomorrow and see. Yeah. The proof is in the pudding. Yeah. And obliques mean diagonal. Cool. All right. So, and that's the best. I bet you, by the way, I feel like, I don't know. I'll ask the other teachers, because I bet you somebody has a way to memorize that, and I don't know. Anyway, Mr. Placencia, did you say something, sir? No. Okay. Your hand's still up, and I heard somebody say something. I guess that's where I got that from. Okay. All right. Cool. Cool. All right, everybody. Okay. Let's talk about bones. Let's just do some quick bone review just to make sure we're on the same page on bones. I feel pretty darn good about muscles. I hope you do. You should. Let's talk about bones here really fast. So I have two questions. One is, and you can just nod because I can see you, at least the three of you that have your screens on. Can you see the slideshow right here that has the back of a skeleton? Two, can you see my cursor on here? Oh, really? Okay, well that is good to know. Yeah, so I could point at a bone and you could tell me what that bone is. Yeah, all right, I like that a lot. Okay, good. Well, let's test this little theory out, all right? Miss Jung, I don't know if you can see this or not, but can you see what bone? Well, now my pointer went. Can you see what bone I am pointing at? The name of this bone?
I cannot see it.
Can't see it? Can you see the skeleton?
Only of it. Oh, I mean, okay.
Ah, all right.
Okay.
So what? Hold on, my cursor keeps going away. What bone is this?
Humerus.
Yeah, humerus. Perfect. Thank you. We're good right there. That's good. That's what I want to check. Thank you. Miss Walker, why?
Yes.
Miss Walker, why? What bone is this up here?
Scapula.
Yeah, what bone is this?
The humerus.
Yeah, and what bone is this? It's kind of hard to tell, but it's the one that makes up your elbow and goes to your pinky.
The ulna?
Yeah, that's the ulna. I don't know if it's clear in here, but you are 100% right. And by the way, if it was not making up the elbow but went to the thumb, what would that be?
The radius.
Yeah, thank you, ma'am. Good job. Miss Walker T. Miss Walker T, where you be? I always picture her like, she's probably working on the roof right now and she's rappelling down really quickly to answer this question. Miss Walker T, are you there?
Okay, sorry, I didn't know you called me.
That's okay. Miss Walker T, what is this medial leg bone here called, the big thick one? Tibia. Yes. What is the skinny lateral one called?
The fibula?
Yeah. And what's this bone up here called above the two of them?
femoral region bone.
Yeah, so we could call it the femur if we want to.
Femur.
Yeah.
It has more to it than femur.
Hey, perfect. That's great. No, by the way, bonus questions. Do you know what the heel bone's called? It does. Kind of like calluses start with a C too, and you get them on your heel. But what?
Calcaneus?
Yeah, that was really good. Calcaneus is your heel bone. Yeah, very cool. But believe it or not, your tibia does not sit on your calcaneus. It sits on a tiny bone above your calcaneus called your talus. By the way, just so really, for everybody's edification here, you've kind of got femur, you've got a patella, right? It's your kneecap. You've got a tibia. Oh, I should have written that down, sorry. You've got a tibia, and it sits on a talus. And that sits on the calcaneus. I like that. Okay. I don't know that you can see any of that, but anyway, I like it. Okay. Thank you, ma'am. Cool. Mr. Blygen. Mr. Blygen. Hey, buddy. Hey, Mr. Blygen, what bone is this that I'm scratching here?
The humerus.
Yeah. Mr. Blygen, which direction is my arrow traveling on the humerus?
Superior.
Superior would be a decent answer. Yes, both of those are correct. So he said proximal because it's getting closer back to the body, and in this case, superiorly. He was right. Very, very good, sir. Sir, what's this bone down here called?
The sacrum.
Sacrum. And what's this part of the hip called?
The posterior iliac.
Wow.
Yeah.
I was just looking for ilium, but you are getting really precise. You're saying like posterior iliac spine or crest or all that stuff. Well done, sir. So what is this joint then between the sacrum and the ilium here called?
The iliosacral joint?
Yeah, or sacroiliac joint. But yeah, we'll take it. Thank you, sir. Thank you. Mr. Brown, are we home?
Yes.
Mr. Brown. Excellent. Is your mother resting?
Yeah, she's laying down.
Good. Mr. Brown, what bone is this right here?
It looks like the femur.
It is the femur. What bone is this, sir?
The other femur.
Yeah.
So, is there a specific because?
Well, you're right. I was saying it to be a smartass, but you're absolutely right. This would be the left femur because it's the client's left, not because it's on our left. If we flip this around, it's the client's left. So, to give you an example. So, this bone on the right here is the client's left femur because we're looking at it in front. So we name them by the client's left and right. So anyway, so this is left femur, right femur. Cool. What's this big, thick medial bone down here, sir?
That's the tibia.
Tibia, sure. What's
tibia.
What's this thin little lateral bone here called?
That one was the fibula.
Fibula. Fibula.
Oh, so it's tibia, not tibula, and fibia, not fibula.
No, you were half right. It's tibia and fibula.
Okay, I had the la and the ia mixed.
Yeah, I'm really confused now, sir, so thank you. I'm not even sure what they are anymore. But it's tibia. I remember that because I used to have a friend named Tibby. And fibula. Tibby. My friend Tibby. Tibia, fibula. Hey, what's the heel bone called, sir?
The Achilles.
What?
The Achilles? Oh no, that's the tendon.
The tendon it is the Achilles tendon goes to this heel bone. But the other name for this, the Achilles tendon, is kind of the name of the heel bone. So the bone is the, that's okay. The bone is the calcaneus.
Calcaneus. Oh,
Yep. And so the
sounds like a super villain.
yeah, and the Achilles tendon is also known as the calcaneal tendon for that reason. Good. Thank you, sir. Miss Estes, this is a little tougher, ma'am.
Hey.
What are the 3 bones that make up the hip? Because there's actually 3 bones that make up your hip. Yeah.
Well, okay, so we have the iliac. What is it called?
Yeah, I love what you're doing. So the iliac crest is called the iliac crest. Ilium. So the top bone up here, everybody, is the ilium. Yep. Then if you go down in front on your body, there's a bone that makes kind of sense how it's named there.
Pubic bone.
Pubic bone. So you got your ilium up top, pubic bone in front, and you're sitting on the other bone. In fact, they call the other bone your sits bone sometimes because you literally are sitting on it, but that doesn't sound at all like that. And do you know what that is?
It's in there somewhere.
It is. It's in your bottom somewhere.
There, that too.
Yeah.
It is called the. No, give me a hint.
I don't actually have a great hint.
Oh, ischial.
Yeah, ischium. Ischium.
Ischium.
And the ischium has the ischial tuberosity on it. You're absolutely right. Well done. So ilium, ischium, pubis. So what did I just say? I'm sorry, I just blanked out for a second.
Ilium, ischium, and pubis.
And those 3 bones make up our hips, but our hips are so complicated that we don't call them hips anymore. We talk about features on the ilium, features on the ischium, features on the pubis. And we will do lots of that later because stuff attaches all over them. All those little bumps are important. Awesome. Thank you, ma'am. Thank you. Hey, Miss Lobitz, what are the 3 hip bones?
The ischium, ilium, and pubis.
Thank you, ma'am. I appreciate it. Miss Modest, what are the 3 hip bones?
Ilium, pubis, and the ischium.
Beautifully said. Thank you, ma'am. Miss Vincent, what are the 3 hip bones?
Ilium, ischium, pubis.
Yeah. I love it. Miss Hawks, what are the 3 hip bones?
The ilium, the ischium, and the pubis.
Yeah. Which one is most superior?
The ilium.
Yeah, she's right, everybody, right? Because that's what we think of as our hip bones, kind of sitting up there, and they're the most superior, they're most high up. Really well done. Thank you, Miss Hawks. Miss Munoz, what are the 3 hip bones?
Ilium, ischium, and pubis.
Great job. Which one's most superior?
Ilium.
Perfectly said. Which one is anterior and inferior?
Anterior, inferior. The pubis?
Yes! Excellent job. Excellent job using your directions, putting it in your head, figuring it out, and that was awesome. Thank you, ma'am. That was really good.
Okay.
Very happy. Miss Suriel. Hello. You're holding your head there. You okay?
Yeah, I'm fine. I was
Good.
just like
You're
using
just
my hands.
trying to massage the information into your head? Yeah.
Yeah.
What are the 3 hip bones?
The 3 hip bones is the ilium, the ischium, and the pubis.
Bam. Oh my God. I can listen to you say that all day. Okay. Which one is most posterior and inferior? Both those things.
Posterior and inferior, it must be the ischium.
It is the ischium. The ischium is in your tuchium. And yeah, it's back there. Good. Beautifully done. Thank you, ma'am. Thank you. Okay, and Miss Routson.
Yes.
Miss Robson, what are the 3 hip bones?
What are the 3 what?
Hip bones.
That is
The ilium, the pubis, and the ischium.
Yeah, that was good. Thank you, ma'am. Good job. Okay. All right, everybody. Let's see. Let's flip our slide here a little bit. These are very scary looking skeletons. They really are. Okay. Miss McDowell, I see you laughing at the skeleton, and so this poor stretched skeleton.
Scary.
Miss McDowell, what is this bone right here?
Femur.
Yep. What's this bone right here?
The tibia.
Yeah. Wait a second. Do you notice something unusual about this person's right leg?
It looks deformed.
Yeah, actually, I'm sorry, it's their right and their left leg. The fibula, everybody, is supposed to be found on the outside of the leg. This skeleton is actually incorrect. They swapped the lower legs on this skeleton. Your fibula is a tiny bone found on the outside of your leg, on the lateral side, and they actually switched it, which means we can't use this skeleton anymore. We spit on this skeleton. All right. Cool. Okay, well, that really answers a lot of my questions. Here, let me stop doing this really quick. Don't go anywhere, Ms. McDowell. I don't want to lose you. Okay. Ms. McDowell, what bone is this?
The scapula.
Scapula. And what's this area above the spinal scapula called?
Supraspinous fossa.
Yes. What's the area below called?
Infraspinous fossa.
Yes. What's the area underneath called?
Subscapular fossa.
Yeah. What's this area called?
Glenoid cavity, glenoid tubercle. No, not tubercle.
Glenoid cavity or glenoid fossa is correct. There is a supraglenoid tubercle and an infraglenoid tubercle, right, where the bis and tris connect. That was good. Thank you, ma'am. Mr. Tate. Yes, sir.
Do you have a page to reference the 3 hip bones? I'm just going to my book.
Yeah. No, I appreciate it.
See it.
No, but look up chapter. I think it's 6 in your trail guide. I'm guessing, but I think it's 6. That's pelvis and thigh. So, yeah, I got stuff to reference. Page 200. Page 278 through 200 and 284 really. 278 to 284. You see all that, sir?
I found the page. 278 to 284?
Yeah. At least in my book it was. It might be slightly off in yours, depending on what editions you and I are using.
Okay, I'm sorry. I was in that section. I kept missing. Sometimes
okay.
that just happens to me.
I
Thank you.
appreciate that you are listening to the lecture and looking stuff up in your book. It's fantastic. Makes me very happy. You keep interrupting like that. That's fantastic. Good. Hey, Mr. Tate, though, while you're here, don't go, though. I want to talk to you about this really fast.
Okay, I'm here.
Cool. What's this place on the scapula called? This place above the spine here?
It's super.
Supra means above. Spine, atus. Supraspinatus fossa.
Supraspinatus fossa.
What's the place below the spine called?
It's infraspinatus fossa.
Yeah! What's the place under the scapula called?
Spinatus fossa.
Subscapular fossa. But you got the right idea. Cool. And what's this cavity here called, or fossa?
Is that the glenoid cavity?
Yeah. Which makes what joint?
The glenohumeral joint?
Yes, sir. Thank you very much. Awesome.
Thank you.
Okay. All right, everybody.